Good morning, this is Sonia Bakod Pasis. I had to discuss about the types of the peritoneal dialysis catheter, but I have only choose the current Tenckhoff catheter. I had to give a brief introduction about the peritoneal dialysis. Peritoneal dialysis is a home-based dialysis modality that involves the insertion of dialysis fluid into the patient's peritoneal cavity for the filtration of toxins and water through the peritoneum via the peritoneal catheter. The fluid is drawn back out of the body and discarded. Common types of peritoneal dialysis catheter are straight Tenckhoff catheter, curled Tenckhoff, swan neck catheter, and Toronto Western catheter. So this is the type of the Tenckhoff catheter, curled and straight Tenckhoff catheter. And this is it looks like when it is inserted to the peritoneum. This is the straight one, and this is the curved Tenckhoff catheter. Curved Tenckhoff catheter is made of translucent medical grade silicone rubber with radiopack stripe. The extra components of catheter have two dicron or the caps. So as we can see at the image here, there are two cups. First cap is superficial and the one is deep cap. Cap made of polyester dicron, allowing tissue ingrowth and fixation, which secures the catheter in place and prevent pericatheter leakage and infection. With the two cap, the proximal cap holds the catheter in place, while the distal cap acts as a barrier to infection. Rationale for use: lower incidence of infection, can easily insert under local or general anesthesia, no leakage of dialysis solution, plenty of holes help to inflow and outflow of the solution. So advantages of using it is longer lifespan, low risk for drains failure, less catheter migration, can be extended or repaired if necessary. Disadvantages are the increased risk of potential dialysis technique failure, inadequate dialysis clearance, and increase in risk of catheter removal. Insertion technique is we have to use open surgical placement, periscopic, laparoscopic, and blind placement with Tenckhoff trocar. So pre-insertion preparation of patients are we have to assess the client if he's having hernia, and if having he consider also repair during PD catheter insertion or before insertion. And we have also to assess patient participation in care and self-management, and we have to discuss the catheter insertion with the patient. And the catheter should not be placed where the pants shirt waistband lies to avoid potential irritation. Catheter exit site should be where the patient can effectively carry out exit site care and assist patient lifestyle, work, and hobbies. Preoperative care should the client have morning bath and shower, and we have to prepare bowel, and you should the client empty the bladder before insertion. So we have to give colite or peg for bowel preparation. Distended bowel and bladder can interfere with the placement and function of the catheter. And prophylactic antibiotics prior, like 1 hour before, to prevent infection and peritonitis. And we have to monitor laboratory values, especially like the CBC, INR. And we have to hold the blood thinners prior to procedure as per hospital guidelines. And we have also to prepare the client psychologically. And post-operative care, we have to reduce any bacterial colonization of the excite and tunnel during healing process. Reduce intra-abdominal pressure to prevent leakage, to prevent trauma on the excite, and traction of cups by immobilize the catheter. So we have to do the following measure need to be followed, like you have to not to disturb for 7 to 10 days the insertion of the catheter. We have to immobilize all the time, so exit site dressing does not get wet. You have to do only sponge bath. So for the first 10 days, exit site dressing done by nurse to prevent dislodgement of the catheter. And we have also to assess the catheter exit site every time we have to do the dressing, and avoid activities that increase intracranial pressure, such as constipation, straining, and bending. This is have to do following insertion of the catheter. So we have to flush with 500 to 1500 PD fluid to check the catheter patency, and we should not be started until healing of the exit site or Dacron cups have taken place, usually after 10 days. And for the long-term care of the exit site, so we have to prevent site infection. So we have to usually have to always wash our hand with soap and water and put clean gloves before cleaning the area. So and also avoid harsh solution to avoid skin damage. And we have also to preferably we have to use antiseptic for the immunocompromised patient to reduce infection, and using antibiotic or prophylaxis like mupirocin and gentamicin cream. And after cleaning, we have to gently pat the skin, like pat it dry around the skin site with clean cloth towel, and avoid skin maceration to reduce bacterial expansion. And we have also to cover with sterile gauze, and we have to change every time the site is to make the site clean. And discourage also to or avoid swimming or immerse in water, like also like tubs, jacuzzi, lakes and rivers, ponds and stream, since they are associated with peritonitis. And for the health teaching, so we have to encourage patients to participate and exit site care, provide emotional support, introduce to support group, and also the family should encourage to participate in care and teach them the complication of PD, and like the kinks and tubing, constipation, fibrin formation, malposition of the catheter, and teach them how to prevent also related infection, to prevent infection. So also clients were also concerned about their body, like body image concern, protruding line from abdomen, limit clothing choice and alter preference, concern about partner's responses or not finding one, and feeling embarrassed and unattractive, withdrawn and depressed. So if it's struggling with how you feel about your body, consider your body is important, but it does not define you as a person. You are likely more critical of your body that others will be, and your feelings towards your body and become more positive over time. So this is my report. There is also the references of my assignment, so you can go over on the references. And this is Sonia. Thank you. Bye.